Pet parents, every fall and winter, I see it. Dogs and cats get stiff from the cold, and owners reaching into the medicine cabinet for human pain medications to help out. What they don't realize is that well-intentioned pill can quickly turn into a very expensive emergency visit. So let's talk about the most common human pain medications I see people give their pets and why they're dangerous. If you want tips on managing your pet's stiffness safely, check out my video on osteoarthritis linked with this video. So NSAIDs, the big category, otherwise known as non-steroidal anti-inflammatory drugs. These include ibuprofen, otherwise known as Advil or Motrin, naproxen or Aleve, and aspirin. They're awesome for people, but dogs and cats metabolize them very differently. In dogs, even one tablet can cause vomiting, stomach ulcers, intestinal bleeding, and acute or a fast kidney injury. Once kidney damage occurs, the remaining healthy kidney tissue must compensate for the loss of function caused by the toxic effects of these drugs. Unlike the liver, the kidney doesn't self-heal, and we often don't know how much healthy kidney tissue is left or remaining. In cats, NSAIDs are extremely dangerous because they lack the metabolic enzyme UDP glucuronidase transferase, which is essential for metabolizing these drugs. So even a tiny lick can cause kidney failure or death. I've seen pets come in critically ill in the ER from a single over-the-counter pill. Many owners say, well, I only gave a baby aspirin. Well, here's the thing. There's really no safe over-the-counter dose for dogs and cats. And in larger breeds, a baby aspirin may not even provide the meaningful pain relief that you're trying to provide. So even repeated small doses can cause ulcers, internal bleeding, and kidney damage. So unless your veterinarian has specifically dosed and approved it for your pet, I would probably skip that baby aspirin. There are other human NSAIDs not quite as common as the aforementioned ones, like diclofenac, celecoxib, indomethacin, and meloxicam in the human dosaging forms. Even though some of these drugs have veterinary versions, the human tablets are way potent for pets and can easily cause toxicity. And then we have Tylenol, or acetaminophen, the drug pretty much everyone has Googled this fall, and the one that can lead your dog or cat in the ER in a hot second. It's a type of pain and fever reliever, but it's not an NSAID, and it's extremely dangerous. In dogs, signs of acetaminophen poisoning typically appear within a few hours of ingestion, but liver damage may actually be delayed for up to a week. It causes many severe signs such as vomiting, nausea, rapid or labored breathing, abdominal pain, swelling of the face, paws, or forelimbs, pale blue or a chocolate brown discoloration of the gums, and coma or death in severe untreated cases. In cats, even a microscopic dose can be catastrophic. It triggers massive inflammation, and it's very similar signs to dogs. It's fast, severe, and often fatal. If you ever suspect your pet has been exposed to any of these medications, especially Tylenol, call your veterinarian and animal poison control immediately. Time is critical, and early treatment can save their lives. Some other common pain medications that I see that some owners reach for is stuff like tramadol, thinking it helps with pain. It's better at probably making your pet a little bit more sleepy than it is for easing pain. It is not really as effective for easing that joint and muscle pain that comes with arthritis as the cold sets in. It can also be dangerous for pets that already have a history of seizures. Gabapentin is similar. It's more for nerve pain than muscle or joint pain, and mostly acts as a sedative. Gabapentin at very high doses can cause sedation or neurologic signs. And some liquid human gabapentin can contain xylitol, which is deadly. If you missed my video on xylitol poisoning, go check it out. It's one every pet parent should see. Combination pain pills like Tylenol No. 3 and even some muscle relaxants can also carry additional risks. But there's great news. There are safe, effective veterinary pain relievers made, especially for dogs and cats out there. But even though these are FDA approved, they still require veterinary guidance and monitoring. We adjust those doses based on your pet's size, age, overall health, and we want to monitor those kidneys and that precious liver function over time. If your pet's in pain, don't guess or Google. While it's tempting to reach for something to provide relief, what might seem harmless could quickly become expensive and life-threatening. Good intentions shouldn't end with an expensive emergency. Like and subscribe if you enjoyed this pet tip, and follow for more tips every week straight from a veterinarian, because knowing your animal starts with